Everybody knows what a heart attack looks like. You see it in the movies. A man grabs his chest, his face twists, he collapses, someone screams, an ambulance arrives. That is the Hollywood version. And for folks under 50, it is often close enough to the truth. But after 65, your heart does not always follow the script, and that is exactly where people die. Not from the heart attack itself, but from not recognizing it was coming, because it did not look the way they expected. I am Dr. George, and I need to tell you something that the largest heart attack registry in the world confirmed when researchers analyzed over 1 million cases. In patients under 45, about 14% had heart attacks without any chest pain at all. That number climbs with every decade. By the time you reach 75, nearly half, 49%, experienced a heart attack with no chest pain whatsoever. Now just sit with that for a moment. If you are over 65, there is roughly a 1 in 3 chance that when a heart attack arrives, it will not announce itself the way you have been taught to expect. It will whisper. And if you do not know what those whispers sound like, you will do exactly what most folks do. You will ignore them. That is what today is about. 5 warning signs that show up hours to days before a cardiac event. Signs that are easy to brush off as aging, stress, a bad meal, or a rough night of sleep. We are going to go from the most commonly overlooked to the one that, when it appears, means your body is sounding every alarm it has. Before we get into the list, I want to know something from you. Have you ever had a strange symptom, something you could not make heads or tails of, that lasted a day or two and then disappeared on its own? Something you shrugged off because it did not seem serious enough to call the doctor about? I think most of us have been there. And for most of us, it really was nothing. But for some folks watching this right now, that strange episode may have been the one warning they will ever get. Tell me what it was in the comments, even if it turned out to be nothing, because your description might be the thing that makes someone else watching this pick up the phone instead of going back to sleep. And if you are finding this helpful already, go ahead and hit that subscribe button down below. It does not cost you a red cent, and it means I can keep bringing you this kind of straight talk information every single week. Now let's get into it. Sign number 5. Stomach trouble that does not behave like stomach trouble. A woman named Margaret came into my awareness through her daughter, who is a colleague of mine. Margaret was 71, lived alone in a ranch house outside Columbus, Ohio. Loved her church, loved her garden, loved the Weather Channel, which she watched with a devotion most folks reserve for their grandchildren. One Wednesday evening, she felt what she described as a heaviness in her upper stomach. Not sharp, not burning, just a dull, pressing weight, like she had eaten too much pot roast, even though she had only picked at dinner. She took an antacid. It did not help. She skipped breakfast Thursday morning because she still felt full. By Thursday evening, the heaviness had crept upward, into the center of her chest and into the base of her throat. She called her daughter and said, "I think I am coming down with the flu." Her daughter, thank God, is a nurse. She said, "Mom, I am coming to get you. We are going to the emergency room." Margaret was having a heart attack. The blockage was in the inferior wall of her heart, the underside, which sits directly above the stomach. When that part of the heart muscle loses oxygen, it irritates the vagus nerve, the nerve that connects your brain, your heart, your lungs, and your gut. And the vagus nerve misfires. It sends nausea signals, pressure signals, fullness signals. Your brain interprets them as a stomach problem. Because why on earth would your heart feel like indigestion? Research published in the International Journal of Cardiology confirmed that inferior heart attacks are significantly more likely to present with nausea and upper stomach pain. Data from the GRACE registry showed that nausea or vomiting was the dominant symptom in over 24% of heart attack patients who presented without chest pain, 1 in 4. And those patients had significantly higher mortality because they arrived at the hospital later, often much later, than those who felt the classic chest pain and reacted right away. If you are over 65 and you develop a stomach discomfort that does not respond to antacids, that hangs around for hours, that feels different from anything you have felt before, do not chalk it up to bad leftovers. That is a call to your doctor. Or if it comes with sweating, lightheadedness, or shortness of breath, that is a call to 911. Not tomorrow. Not after you see how you feel come morning. Now, sign number 4. A tiredness that just does not make sense. This is the one that breaks my heart, because it is the most commonly dismissed of all 5 signs, and it hits women especially hard. A landmark study published in Circulation followed 515 women who had confirmed heart attacks. 95% of them reported warning symptoms in the weeks before the event, not hours, weeks. And the single most common symptom, reported by over 70% of those women, was unusual fatigue, not regular tiredness, not the kind you feel after a long day of doing chores or minding the grandkids, a fatigue that arrived without any good reason and would not leave. The kind where you sit down to fold laundry and have to stop because your arms feel like they are made of wet sand. The kind where your husband asks if you want to ride along to the hardware store and you say no, not because you do not want to go, but because walking to the car feels like too much. And here's the part that keeps me up at night. Only 29% of those women reported any chest discomfort at all in the weeks before their heart attack. 70% had fatigue. 29% had chest pain. The symptom that nearly everybody is taught to watch for was absent in 7 out of 10 women. The symptom nobody is taught to watch for was present in 7 out of 10. If you are a woman over 60 and you are running on empty for no good reason, and rest is not putting a dent in it, and it feels different from your regular tiredness, please do not just write it off as getting on in years. That may be true, but it may not be. And the cost of checking is an appointment. The cost of not checking can be everything. I want to stop right here and ask you something directly. How many of you have been told, by a doctor or by someone you trust, that something you were feeling was just a normal part of getting older? That it was just stress? That you ought to rest more and worry less? I hear this from folks every single week, and I genuinely want to know your experience. Because that conversation, the one where a real symptom gets waved off as normal aging, is one of the most dangerous conversations happening in medicine right now. If that has happened to you, tell me about it down below. I read every comment. And while you are down there, if you have not subscribed yet, now would be a real good time. Every week I bring you honest, research-backed information like this, with no nonsense and nothing to sell you. Just the straight truth. Hit subscribe, and you will not miss a single one. Sign number 3. Cold sweats when you are not doing a blamed thing. This is the sign that most folks recognize after the fact, but almost never catch in the moment. You are sitting in your recliner, maybe watching Wheel of Fortune, maybe reading the paper, and suddenly your shirt is damp. Your skin feels clammy. Your palms are wet. You are not hot. You have not lifted a finger. There is no earthly reason for your body to be doing this, and yet there it is. The SWIMMY study, one of the largest investigations into this specific symptom, examined nearly 12,000 patients experiencing acute coronary events. Among those with complete coronary blockage, over 90% broke out in a cold sweat. 90%. That makes this kind of sweating one of the single most predictive warning signs of a serious cardiac event. Here is what is happening. When your heart begins to struggle, when a coronary artery narrows critically or spasms, your body activates the sympathetic nervous system, the same system that would fire if a stranger broke into your house at midnight. Adrenaline floods your bloodstream. Your heart rate jumps. Your blood vessels tighten up to push blood toward your vital organs, and as a side effect, you sweat. Cold, clammy, out-of-nowhere sweating. Your body is reacting to a threat. The only difference is the threat is inside your chest, not at your front door. If you are sitting still and you suddenly feel cold, damp, and clammy for no good reason, do not just walk it off. Do not wait for it to pass. If it comes alongside any other symptom on this list, or even if it does not, Call for help. That is your body pulling the fire alarm. 2 more signs to go. And these last 2 are the ones folks dismiss most easily because they feel like they could not possibly have a single thing to do with the heart. One involves a pain that shows up somewhere you would never in a million years expect. And the other involves a feeling so strange that most people are flat out embarrassed to mention it to their doctor. Sign number 2, pain in your jaw, your neck, or between your shoulder blades. A retired postal worker named Henry, 68, went to see his dentist on a Monday morning convinced he had a toothache in his lower left jaw. He said it had started over the weekend. A dull ache that came and went. Worse when he climbed the stairs, better when he sat down. He figured maybe he had been grinding his teeth in his sleep. His wife told him it was probably a cavity. He believed her because simpler explanations are always easier to live with. His dentist looked him over, found nothing wrong with his teeth, and to her enormous credit, asked a question that most dentists would never have thought to ask. Does this pain get worse when you exert yourself? Henry said yes. She told him to skip the filling and go straight to the emergency room. He argued. She held firm. 3 hours later, Henry was in a cardiac catheterization lab with a stent being placed in a severely blocked coronary artery. His toothache was his heart. This happens because of the way your nervous system is wired. The nerves that carry pain signals from your heart share the same pathways as nerves from your jaw, your neck, and the area between your shoulder blades. When your heart muscle is starving for oxygen, the pain signals travel up through the spinal cord and get all mixed together with signals from those other areas. Your brain cannot always sort it out, so it interprets the cardiac distress as a toothache, or a stiff neck, or a deep ache across your upper back. A study of 186 patients with confirmed cardiac ischemia found that 38% experienced pain in the face or jaw region. In 6%, that was the only symptom. No chest pain, no arm pain, no shortness of breath, just a toothache that was not a toothache. And research confirms that women are significantly more likely than men to show up with jaw pain, neck pain, and back pain, rather than the classic chest pressure. Here is why that matters so much after 65. As the overall likelihood of feeling chest pain during a heart attack drops with age, these other locations become more common, not less. Your heart is still sending out distress signals. It is just sending them to a different address. If you develop a new, unexplained pain in your jaw, your neck, or between your shoulder blades, and it comes and goes with exertion, that is not a dental problem. That is not a pulled muscle. That is a cardiac evaluation. Same day, not next week. Have any of you ever had an ache in your jaw or your neck that came and went and you just could not put your finger on it? Maybe it cleared up on its own after a few days and you forgot all about it. Maybe you are feeling something like that right now as you watch this. Whatever it is, share it down below, because I promise you, somebody else watching this is experiencing the exact same thing and wondering whether it is serious enough to mention. Your comment might be the one that convinces them to make the call. Sign number 1, a feeling of doom that arrives out of nowhere. This is the one most folks will never bring up to their doctor because it does not sound medical. It sounds like nerves. It sounds like anxiety or overthinking or watching too many health videos on the internet. And that is exactly why it is the most dangerous sign on this whole list. Every now and then, your body gives you a signal that bypasses logic entirely. A deep, gut-level, whole-body sense that something is terribly wrong. Not worry, not fretting over the bills, or the grandkids, or what is happening in the news. Something darker, something that settles right in your gut and will not budge. A certainty that you are in danger, even though nothing around you has changed. You are in your living room. The door is locked, the TV is on, and yet every fiber of your being is telling you to be afraid. The Medea study, conducted across multiple centers in Germany, documented that 15% of heart attack patients reported a distinct fear of death during the acute phase. Separate research found that 35% of women reported new or worsening anxiety in the weeks before their heart attack. These are not small numbers, and the timing is critical. That feeling often arrives before any physical symptom, before the chest pressure, before the shortness of breath, before the sweating. The emotional alarm goes off first. Here is what is happening in your body. When oxygen supply to your heart begins to drop, even slightly, even before you feel pain, your body releases a flood of stress hormones. Adrenaline, cortisol, norepinephrine. These chemicals set off your limbic system, the emotional center of your brain. Your thinking mind has not caught up yet. It does not know why you are afraid, but your nervous system knows. It has detected a threat your conscious mind cannot see, and it is trying to warn you in the only language it has left. If you ever feel a wave of fear or dread that comes on without any good reason, that does not match anything going on around you, that feels fundamentally different from your ordinary worries, do not write it off as nerves, especially if it comes alongside any of the other signs we have talked about today. That feeling is not irrational, it is not all in your head, it is in your chest, and it deserves immediate attention. Now let me bring all of this together because I do not want you to walk away with a list that fades by supper time. 5 warning signs. Unexplained stomach discomfort that does not respond to antacids. A bone-deep fatigue that does not match your day. Cold sweats while you are sitting in your easy chair. Pain in your jaw, your neck, or your upper back that comes and goes with exertion. And a feeling of dread that arrives without a reason. None of these are dramatic. None of them look like the movies. And that is precisely what makes them so deadly. Because the folks who die from heart attacks after 65 are not, for the most part, the ones who grab their chest and call 911. They are the ones who say, "It is probably nothing," and go back to bed. Margaret is alive because her daughter is a nurse. Henry is alive because his dentist asked the right question. You may not have a nurse for a daughter or a dentist who thinks like a cardiologist, but you have this information now. And information, when it arrives in time, is worth more than any medication I could ever prescribe. Write down these 5 signs. Put the list on your refrigerator, right next to the grocery list and the grandkids' school photos. And if you or someone you love experiences even one of them, do not sit around waiting to see if it gets better on its own. Call. Because the difference between the folks who make it and the folks who do not is almost never the severity of the heart attack. It is the speed of the response. Everything I have shared today is general educational information based on published medical research. It is not a substitute for your own doctor's advice. If you are experiencing any of these symptoms right now, please stop watching this video and call 911 or your local emergency number immediately. For everyone else, please have a good sit-down conversation with your physician about your individual risk factors. They know your history, and that context matters more than any video ever could. Take care of your heart. It is the only one you will ever get. And if it has been trying to tell you something lately, in its quiet, roundabout way, maybe tonight is the night you finally listen. Now, if this is the kind of honest, plain English information you have been looking for, the kind that does not try to sell you anything or scare you into buying something, then I would be mighty grateful if you hit that subscribe button right now. It is free, it takes all of 2 seconds, and it is the best way to make sure you do not miss a single week. Every week I come back with research-backed information like this, information that could save your life or the life of someone you love dearly. So go ahead and subscribe, share this with a friend or family member who needs to hear it, and I will see you right back here next time, because there is a whole lot more to cover, and I am not going anywhere.